All right, well, welcome to the Healing Your Pet podcast. I'm Jesse Roberts, and you'll be seeing Alex in just a second here. We know it's been a little while, and we apologize. Everybody in the house has been sick, and it's been brutal, but we're finally getting better. So we apologize once again. So a few weeks back, we did talk about kidney disease, and we talked about some of the common causes of kidney disease in pets, dogs and cats. Not, cats tend to have more of an issue with it than dogs do. But we wanted to give you the main factors as to what causes kidney disease. And if you don't remember, you can always go back and check out last week's, or I guess not last week, but the last episode a few weeks back. And the main factors were diet, vaccines, and environmental causes, like environmental toxins. So diet is always the most important factor when it comes to managing any disease, especially in humans and pets. But the most popular forms of pet food on the market are heavily processed. Most pets eat hard, dry, crunchy bits of kibble, and unfortunately, these are the most popular forms of pet food, but they're also usually the most affordable. So we understand, it's a lot of times it's the most economical decision. You get the most out of it. But there are things you can do from a dietary perspective that are they're honestly the most important things you can do. And here on Healing Your Pet, we always recommend, if you can do it, to feed a raw or a fresh diet. Protein and fat based, so animal based. Then try to cut out all the carbohydrates you can, because carbohydrates are usually a huge cause of chronic kidney issues. And so there are plenty of commercially available raw foods on the market. You can also try doing canned food, because the moisture aspect has a huge part to play in this. But we're going to hear from Alex here as to what you can do from a dietary standpoint to help manage chronic kidney disease.
All right. So, first of all, I just want to say that if I look like I crawled out of a dumpster, it's because I feel like I just crawled out of a dumpster. So, glad to be back after dying for the last 3 weeks now. So, anyway, food and what we can do to help support kidneys. Food is number one. I kind of say that about everything, but it's very much true in kidney disease. Probably the number one most important factor that we're thinking about with food is moisture. The kidneys, we talked about, they can't really regenerate their cells very well once they're damaged. And, obviously the kidneys are what creates urine, which needs to, it has to suck fluid out of your body in order to then pull those toxins out that it's trying to get rid of in your urine. I shouldn't say toxins, it's not just toxins, but waste products, toxins, and just naturally formed metabolic waste products that your body makes that are excreted in urine. In order to create that urine as the carrier for those waste products, your kidneys have to pull some fluid out of your body. So that's simplified picture for why in kidney disease specifically, moisture is so important. So moisture in the diet, really, really important, which basically means you kind of can't feed kibble. It's just, we talked about before how it's really just impossible to make up for the dehydration created by kibble. So I don't really know how else to say that one. Really, really avoiding kibble if at all possible. And if for some reason that's not possible, adding in as much moisture as possible into the food. So we can do that with bone broth or goat milk. Lots of options are available out there, but avoiding kibble, if possible, is definitely highly recommended. So what is ideal? Homemade food is ideal. You know, we talked about that generically. Homemade food is always ideal. What makes it particularly ideal or appealing in this case is you have an animal that now has this special need, and by the only way to really tailor food to the special needs of your individual animal is by doing a homemade food. It doesn't matter how good of a commercial food you're buying. It is what it is. You know, you can add stuff to it, but you can't alter the base of what it is. Whereas when you're making homemade food, you can alter the base of it. That's what you're doing. That's kind of the whole point. So homemade definitely possible, or homemade definitely ideal, but there are compromise possibilities. So there are now 1 or 2 prescription fresh food companies. So you can talk to your vet about this. They do exist. If you have a conventional veterinarian, they're probably not aware that they exist, but you can look into those so essentially renal prescription diets with fresh or raw food. I know of only 1 or 2 companies that I know of, but they exist. They're not cheap, but they exist. So those are a really good option if, you know, maybe you'd rather spend a little more money and you feel like you don't have the time to invest in the homemade food. You know, that's kind of, I feel like that's really the biggest compromise with homemade food is you can make homemade food really cheaply compared to even like kibble. Like you can spend less money on homemade food than a quote unquote decent kibble, but obviously it's a little more time consuming than just feeding a pre-made food. So that is kind of the trade-off, but something to consider if maybe that is a better option for you. And then there are lots of in-betweens, you know, even feeding a commercial dehydrated or freeze-dried food, and then you're adding plenty of moisture back in. You know, those bags or boxes that those food products come in have a recommended amount of water to add, but you can add more. You know, the more the merrier. I do find a lot of animals prefer kind of a certain water ratio in there, and sometimes they just like it drier. Like I've had animals where it's like they like it practically bone dry, and then they won't touch it if you put the recommended amount of water in it. So that can cause a bit of a conundrum, but that's an option. And then you just really get as much moisture in there as you possibly can. You can be adding in, you know, if you're feeding a processed food, you can be adding in fresh foods in order to kind of boost those processed foods. So boosting the processed foods or commercial foods, it can look like adding in fresh kidney is a really great option if you can find it. I really do like the theory of like supports like. So we have kidney problems. Let's feed some nice fresh kidney or desiccated kidney also, but that's kind of more of a supplement than really adding in a food. That's a great option. It's not going to hurt, you know, and then if you can find the fresh kidney, most dogs and cats love it. They go nuts for it. So it's a great option if you can get your hands on it. And think antioxidants. So things like parsley, asparagus is kind of a weird one, but that can be good for kidneys. These dark leafy greens, especially if you are feeding a processed food, a more heavily processed food, not like a commercial fresh food or a homemade fresh food. Adding in these dark leafy greens then is more something I would recommend. I don't love adding in a bunch of extra fiber. It's kind of an anti-nutrient, but you're still getting antioxidants from these things. So something to consider, kind of playing around with what your pet does and doesn't like. It's a great help. Fresh dandelion greens, those, it seems like a lot of grocery stores now actually carry them. That specifically is a great one. So another really big picture item is protein. If you've had a pet diagnosed with kidney disease, you've probably been told or heard or read a lot about protein and what do we do about protein? So there really is no good data suggesting that lowering the protein quantity is beneficial. There just isn't. If anything, the research that we have available shows us that feeding more protein is beneficial, or at least it's more beneficial than feeding less protein. So my philosophy is maintaining high quality protein is really important. That's what we're shooting for. High quality, as fresh as possible protein sources. Whole, nice complete protein sources is really important for us here. So again, kibble, you're not getting that. If you're doing like a commercial dehydrated food, I do really recommend adding in your own human grade, high quality protein sources to that, so that we are getting plenty of protein to nourish struggling organs. That's what they need to build themselves, right? So what kind of goes along with protein is phosphorus, which might also be a topic that you've heard about from your vet or read about. This one's a little less cut and dry, but especially if you have a more advanced renal disease, decreasing the phosphorus may be necessary. So when feeding a commercial food, you don't really have control. The phosphorus in the food is what it is. Again, kind of a big a leading factor in why we want to do homemade food if at all possible, or the prescription diets, also possible. So to decrease phosphorus in homemade food, pretty easy. The biggest source of phosphorus comes from bone, which is usually what we're using as a calcium and phosphorus source, along with many other things, but those are kind of the big micronutrients that we need the bone added in for. So pretty simple. You just replace bone with eggshell, because eggshell is basically, we think of it as just a calcium source minus the phosphorus. So homemade food, decreasing phosphorus, really simple, honestly. Beyond that, gets a little complex. And I think those are all of our big points as far as the diet and what you can do for just any kidney patient to help improve the basis of what they're eating, which is absolutely the most important thing, again, with any disease. But it really, really in particular is important here because it's what we do have control over, right?
So while you're here, before we continue on to the next part, please stop what you're doing, like, subscribe, and share this video with anybody you know that may have any questions when it comes to pet-related needs, or leave us a comment if you have any questions or concerns. We're always willing to help you out. Okay, so now that you heard about what you can do about chronic kidney disease when it comes to diet, the second and third causes of kidney issues, which we discussed in the last podcast, are vaccines and medications. That we'll call that one group, and then the other group are just environmental factors on, in general. So when it comes to vaccines and medications, they can contribute to long-term development of chronic kidney disease, and it's also, even acute kidney disease too. But usually, acute kidney disease is more of a medical emergency type of situation. And when I'm saying kidney disease, we are talking about what they would call kidney failure or renal failure or just renal disease, pretty much the same thing. So I know that when it comes to vaccines and medications, it can be hard to bypass. So what can you do here? Well, we'll figure that out in just a second, because we also need to remember that the third cause of kidney disease, third major cause, are environmental factors. So pets are constantly exposed to nasty stuff all the time, just like we are. Think about all the things that you come across every day. Okay, so imagine you walk to work, you walk to the park, you're walking outside, you go to the grocery store, what have you, and you imagine doing that without shoes on. Yep, it's pretty gross. Your pet absorbs so many environmental toxins right through the pads of their feet, and they they're pets. They get into everything. They'll eat things you would never eat. They run around outside getting into stuff that you don't know what sometimes, right? So, those are the two main factors aside from diet that cause chronic kidney disease, being environmental factors, and let's just say generally like a medication factor, including vaccines and medications.
All right, so addressing toxins, we kind of talked about what to avoid, right? What to avoid, how to avoid them. You've kind of got to do what you need to do in your own life to avoid those toxins as much as possible. That is what it is. Again, food, when we're talking about trying to detox the body, the diet is the basis of that. You can add in all the supplements in the world. If you're eating a crappy, heavily processed food, that in itself is going to continuously build up more toxins in the body and just make it so it can never really catch up and compensate for that. But if we've got a good diet, some kind of not heavily processed diet that we've started on, we can start adding in some supplements on top of that to really give some extra support for trying to detox and specifically support the kidneys. So there are honestly a ton of different supplements that can be used, but a lot of them are pretty individual. So I'm going to give you some ideas for things that really can safely apply to anyone. So first one, a good probiotic and digestive enzyme. It's kind of good for everything, but you've got to start with the gut you've got to heal that gut to nourish everything else. And that absolutely includes your kidneys and detoxing the body and that whole urinary pathway. Very important. So a probiotic with a prebiotic in it to feed those good bugs, and a digestive enzyme, whether that is part of the probiotic, product, or you get digestive enzymes as a separate product. Really, really important. Definitely highly recommend starting there at least. Next one is a well, really an omega-3 product. I kind of say fish oil as a blanket term, but an animal-based omega-3 product is really what I'm recommending. So, essential as an anti-inflammatory, an antioxidant, and a nice fat balancing source. It's really important. Again, kind of for everything, but absolutely getting as much antioxidant and anti-inflammatory, decreasing the inflammation, getting in as much antioxidant products as we can into the body that's what we want here. And it kind of, I would say, specifically for the kidneys, again, it's good for everything, but if you go back and think about how poorly the kidneys regenerate themselves, it's like they really need that extra helping hand that much more. So we talked a little bit about, as far as the diet, adding in fresh kidney is really awesome, or a desiccated kidney, but same concept. But as far as a supplement form, so either like desiccated kidney capsules, you break them open. I mean, dogs and cats generally love the taste of them. Unlike us, most humans in the Western world, I guess, at least, myself included, not really a fan of kidney taste. I like to take it in capsules, but your pet normally loves it. So you break that open on their food, they love it. Or a true glandular product, where it's actually like an extract of kidney. Same concept of just like supports like. I've really found that to be really beneficial. So I do highly recommend that. As far as the research that's out there, it's a little bit mixed, but there is definitely some good data to support that does actually help. And there are many clinicians, human doctors and veterinarians that would agree that they have observed that really being a beneficial addition. And I think the last blanket thing we'll address are herbs you can use. So the big ones that I like to recommend, at least as a starting point, dandelion leaf specifically. If you have like a tincture that has leaf and root, that's all fine and dandy, but I just say leaf specifically more for the kidneys. But I do actually really also like the leaf root blend, because you're getting a little bit more of a broader organ system support when you have both the leaf and the root, and that it's, we are one functioning organism, just supporting one organ system that's struggling for a reason. We really need to be looking at the whole body. So I think of it as the dandelion leaf has properties that are a little more specific in helping the kidney, but I really like doing a leaf and root blended product, because then you're doing a little bit more holistic support of other organ systems as well, so that everything can be working in harmony. Hawthorn, like a hawthorn berry product, you can buy in tincture or capsules. This is really, really good for circulation and the heart specifically. There have actually been studies showing that it can help regenerate your cardiac myocytes, so your heart muscle cells that have been damaged. So this, your pet has a kidney problem, hasn't been diagnosed with a heart problem. Why do we care about the heart? In advanced kidney disease, we tend to end up at some point in heart failure as well, because of the circulation in the body, basically. Serious chronic kidney problems, and then chronic heart problems tend to go hand in hand, at least at some point down the line. So specifically, hawthorn is a good, again, generic kind of blanket recommendation for that reason, not just because it supports circulation in general, including to the kidneys, which is super important to try and nourish them, but because it also really specifically helps the heart, which is unfortunately something we kind of have to worry about here as well. Next up, astragalus. So astragalus is, it's kind of this like amazing, not cure all, but it's a supports all. It has an affinity for many systems of the body, but really great immune support. And some of the systems included in its affinities are both the kidneys and the heart, and the liver as well, which, talking about trying to rid the body of toxins and waste products, the liver is kind of our kidneys' partner in being, incredibly important in all of that. So really good, kind of putting all the pieces together, kind of good for everything. And it has a warming properties. This is a traditional Chinese medicine term, but when we have a chronically debilitated organ, which happens almost solely in older patients, they have a deficiency of something. Oftentimes it's a qi deficiency in chronic kidney disease, or a blood deficiency, and the astragalus helps to kind of warm up those deficiencies, kind of try and bring these things back to life. This is the way I think about it. I don't know if your brain works anything like mine. Maybe that's a slightly helpful description. I don't know, it might not be. Sorry if it's not. But moral of the story is kind of helps for everything, and definitely specifically lots of different things that are really important in trying to support kidney function. And you can think of it as kind of warming up these organs that are trying to get old and give up and die on us, old, cold, dead things, right? We're trying to do the opposite of that. And it really helps with trying to do the opposite of that and bring these things back to life. And a final herb that I often recommend is marshmallow. So one, it's incredibly safe. It can be used long term, like even cats who tend to be just kind of more sensitive to everything. So that's nice. And it's pretty much, its affinities are, it helps soothe any kind of mucous membranes. So it has affinities for the urinary tract, which that's kind of the system we're talking about with kidneys. Some specific instances where I would really consider it are if you have a pet that has any history of respiratory issues prior to or concurrent with their kidney problems, because it also has an affinity for those respiratory surfaces. And also if they have had digestive upset issues, again, historically or concurrently with the kidney issues, really helps soothe those digestive issues. So I'd say those are specific instances. It does help with supporting the immune system just overall. Again, that's an important factor here. And I think that is about it for specific recommendations that can really apply to any critter safely that has had the misfortune of being diagnosed with chronic kidney disease. So thank you. And I really, really hope this helps for anyone that's out there struggling with this, because I know it's a really terrible thing to hear, and it's incredibly stressful because especially if you have a conventional veterinarian, you're kind of told, okay, here we are, and it is what it is, pretty much. And then, if you're trying to do your own research and find out what you can do, there's a lot of conflicting information out there. And it's like, okay, well, what is true and what isn't? So I really hope this can help some of you. And as always, I wish you and your pets the best of health. Bye.
Okay, so remember, there are things you can control when it comes to getting a handle on chronic kidney disease. Diet is by far the most important factor. Now, feeding a raw food or a less processed food is probably the best way to deal with this issue. And also look back to the things you can do to get a handle on toxin exposure through medications, vaccines, the environment, and all these things come together. Like I said before, our philosophy when it comes to feeding is you should most definitely consider doing at least do a commercially raw diet or a less processed diet. And it's especially true for cats. I mean, dogs certainly shouldn't be eating kibble either, but we have done episodes, and if you check out our Substack newsletter, which I'll link in the description of this video, I wrote a lengthy article a while back, but cats should not eat carbohydrates at all. Cats are obligate carnivores. Their carbohydrates are something their bodies cannot handle. And all kibble requires carbohydrates to be a thing. And that's one of the major causes of chronic kidney disease in cats is the diet. Things like diabetes and kidney disease and stuff, these were very, very uncommon years back until we started seeing these massively processed commercial kibble food. These things have become the staple of pet food. So always look back on what you can do based off what we say in this video, but you should always ask your vet if you have any questions. We are not veterinarians, so anything in this video should not be seen as medical advice. This is mainly our opinion on things based off of our experience and things we read. We do tons of research, but I cannot tell you to do one thing or the other. I just only ever, like I said, just my recommendation is check out Feeding a Raw Food Diet. If you are having long-term issues when it comes to kidney disease or kidney problems, I 9 times out of 10, that will help tremendously. So nothing in our podcast should be seen as medical treatment advice. We're not here to diagnose, prevent, treat any disease. So just do your own research and ask your vet if you have any questions.